Yeah, so it's nice to do a very good turnout here.
My name is Mary Payne. I'm a fourth year medical student here at the Wellington campus. And last year I took a year off medical school to take on an honors project focusing on spirituality, health, and medical education. Fourth year of med school, it's a pretty awkward and scary time. It's your first year at the hospital. You don't really know what your role is, and you're also told conflicting things. Like on one hand, you're told to be proactive and engaged, and then on the other, you're told to stay out of the way. It's kind of funny, actually, well, maybe sad from your point of view, but my colleagues and I laugh about it all the time. When you walk into a room, you can immediately tell who the medical student is. They're the ones standing in the corner, holding a big pen with a 3B1 notebook, looking really out of place. I mean, it's sad, but we laugh about it all the time. All that aside, though, fourth year is also a very interesting period. I think coming into the clinical scene with fresh eyes, it holds a lot of value. You're in the front row seats, you're observing the senior health professionals treat each other and treat their patients. You can see very well the intersection between medical knowledge, something very methodical, very deductive, to the human and intangible side of healing and caring. At this point in our training, medical students are very subject to many influences, which help us mold into the kind of doctor that we want to be. So, being in clinical placements, that's one influence. And for me, and hopefully for many medical students in the future, learning about spirituality and health is also another influence. So my project, I interviewed 16 medical students, some in their first year, some in their final year. And for the purposes of this symposium, I'll focus on findings that solely relate to spirituality and mental health. But just for context, these are also some of the themes that I explored. So spirituality as a concept, spirituality in health and patients, spirituality in health and medical students, spirituality in healthcare, and spirituality in medical education. I think before I move on, it's important to acknowledge that mental health is understood in many different ways. So this is what the WHO defines as mental health. And I think it's important to acknowledge this because in my interviews, some of my medical students talk about mental health specifically, and then some of them talk about elements of mental health according to this definition. And the most common element that came up in my interviews was the bit that says, mental health helps you cope with the normal stresses of life. So when I talk about, what my participants are talking about, I will let you know when they say mental health specifically, and when they talk about elements of it. So in my research, I asked the medical students to define spirituality. I also asked them how they manage when they are unwell. And that's in line with Tafari Kapapa, I kind of expanded, what unwellness means. So I asked them, how do you, manage when you're unwell, either physically or mentally, or family-wise, or spirituality-wise? And so those are the questions that I asked them, or some of the questions. And what was striking to me is that when they defined spirituality, they also described elements of mental health. For example, this medical student, she identified as spiritual and held Buddhist principles. She described spirituality as encompassing her wonder about forces that might control things. And then when I asked her how she manages when she's going through difficult times, this is what she said. Thinking, that the situation is not under my control, but under someone else's hands. That's what helps her get through difficult situations. So if you can see, when she talks about, how she manages her own health, it describes elements of mental health, but also elements of spirituality. So you can kind of see the link there. Another example, this medical student, they were spiritual, and they're just starting to explore Christianity. And for them, spirituality is all about, having something to keep you going, having purpose and hope, knowing that everything is going to be okay. And then when I asked them, how do you cope when you're unwell? They told me with a specific example, when she's finding medical school hard, she thinks about the end, when she is in a position to help others, and that thought is what helps her keep going. So you can see that her definition of spirituality has some links to how she copes when medical school is hard. These are just some other examples, but I won't go through them. So just then I talked about spirituality and student health. Now I'm going to talk about what these medical students think about spirituality and patient health. So these students mentioned mental health explicitly. And these are responses to the question, how do you think religion or spirituality might impact patient health and well-being? The first one, this student talked about how, to him, spirituality is something that the mind produces. And so if someone is unwell, then how can someone be spiritual? That was their opinion. The second one, they acknowledged that a change in one dimension of health, so spiritual dimension, can easily affect another dimension of health, mental health. So that student acknowledges the link between the two. These two students, they didn't explicitly say mental health, but they kind of mentioned elements of it according to the WHO definition. To them, they think that for patients, spirituality and religion can either give them strength to get through anything difficult, or can give them confidence to get through anything. So you can see that that's elements of mental health as well. If anything, I think this quote captures a lot of what I've been trying to talk about. So this medical student, neither religious or spiritual, they describe spirituality as a language that people use to describe elements of mental health. So this is what they said. I think it's important that as a health practitioner that we sort of go, well, spirituality is a language that other people use as well. So it's important that we, even if they're not religious, we talk about spirituality for them to make sure we're not missing an opportunity to talk about something that they do for their mental health. Because for me, sort of meditating is looking after your mental health. But for other people, it might actually be that, that's a spiritual realm. And so it's important that we use the language that they want to use. So in summary, many medical students identify the link between spirituality and mental health. But also, we need to acknowledge that, some people understand spirituality with elements of mental health in there. And I think it's been reflected in literature that those two things are often quite conflated, spirituality and mental health. But quite rightly, what this person is saying, it doesn't really matter what you call it. If it's what gets someone, get through a difficult time, that's what's important. As a personal note, I thoroughly enjoyed doing this research. When I think about the impact that it's given me, I think it's changed my perspective, or given me more of a holistic perspective of the patient in front of me. They're not just this medical entity that needs fixing. They're actually a person with complex needs. I think this project has just, because I think of the patient now in a holistic way, it makes you more attuned to their needs. It makes you respect their space, respect their dignity. And so, for example, in ward rounds, I think, consultants, they're very busy. They've got a lot of things in their minds, which probably means that a lot of things slip. But if you're present, if you look at the patient in front of you as a person, you notice little things like, okay, maybe I should put the shoes back on after the doctor just examined their foot. Or maybe I should turn the light back off because they were just sleeping before we leave, or close the curtains back. So it's just those little things. But I think if I was a patient and someone was walking into my room every day at 8 a.m., I would like for things to be returned the way they were so I can go back to sleep or something like that. I think another impact it's given me is that it's given me the vocabulary to ask patients quite difficult stuff. So earlier Richard was talking about spiritual literacy, and I think if I didn't take on this project, I wouldn't have been able to talk to patients in such depth. Like often I would ask my patients, you've told me about your medical conditions and stuff, but like how do you make sense of all of this? And like probably for you then cried right in front of me. And if I didn't take on this research, like I wouldn't have been able to, have that vocabulary to tap into the patient experience. Mm-hmm.
It's really fascinating and great to hear, medicine considering spirituality. So we've got about 3-4 minutes for questions. Does anyone have a question? Just raise your hand if you need it now.